What lowers blood sugar naturally? We do have to eat a certain way to lower blood sugar, but we also need to make our cells more receptive to insulin so that the body can lower the blood sugar the way it's supposed to naturally. So I'm going to be talking about some things that you can be doing to make sure that that is happening. But first, a little about me. I am Angela, and I'm a certified health coach. I have over 20 years experience as a registered nurse and functional medicine training as well. First, I want to talk a little bit about insulin resistance before we really get into the things that you can do to lower blood sugar naturally. Because, like I said, if your cells are not sensitive to blood sugar, if you have insulin resistance, you are going to have a higher blood sugar most of the time. However, it can also be really low at certain times of the day, especially like your fasting blood sugar might be really low. But that's only because the body is really cranking out the insulin, trying to get that blood sugar under control. Because the blood sugar being high is damaging to the body. It's damaging to many of your cells in your body. So insulin resistance is a stage that you may not be aware of. You probably won't be told by your doctor you're in insulin resistance. It's going to be when you hit prediabetes, it's going to feel like, what happened? I was fine just last year on my blood work. Everything looked great. And that will be true if you just get conventional labs with just a fasting blood sugar and maybe a hemoglobin A1C. Those will probably look pretty good when you're in insulin resistance. What we need to know is the fact that, number one, your fasting blood sugar being really low whenever you know you're eating in a way that you should have a higher blood sugar. You would have higher numbers because of the way that you normally eat. That's a red flag. And also, the other lab that would be helpful to know in that stage is actually your fasting insulin. Rather than just checking fasting blood sugar and even the glucose tolerance test, a fasting insulin and then an insulin test that is similarly done to the glucose, where you have something really sweet and then you check your insulin level about 2 or 3 hours later. That is going to be more telling about where you are in the dynamic of developing insulin resistance into diabetes. Okay, so now that you know a little bit about insulin resistance, that's going to help to understand why some of the recommendations that I have are related to helping your cells, your body's cells, to be more sensitive to insulin. But another thing that I think it's important to address is that we want to control our blood sugar, not just to reverse diabetes or reverse the condition that can be leading into diabetes and all that entails, all of the downstream effects of being diabetic, but also because having hyperglycemia, high blood sugar on a regular basis, does cause damage to the arteries, which leads to atherosclerosis and subsequently heart attacks, heart disease, and it also causes high cholesterol, hypercholesterolemia. So having high cholesterol, of course, is also another predisposing issue with the heart. But it's more a factor of eating in a way that causes high blood sugar rather than eating high fat foods. So eating fried foods and foods that are high in trans fats or have trans fats, those do cause high cholesterol and problems of their own. damaging our body cells as well. But having high healthy fats does not affect your cholesterol in the same way that we used to think. So it's more about the high blood sugar that we need to be concerned about. And also, Alzheimer's is also called type 3 diabetes. That is a kind of a nickname, I guess you could say, of Alzheimer's, but it's named that way, and we were calling it that because it has been shown that having high blood sugars with or without a diabetes diagnosis can lead to Alzheimer's. So that's why we really want to keep our blood sugar low. It's just those are just some of the effects. There's lots more actually, but those are the big ones. Number one, and most obviously, is to eat whole foods and try to eliminate, depending on where you are, you might just have to eliminate all refined foods, meaning foods made with flour, any kind of flour, except the high protein flours. As far as for your blood sugar, they don't affect your blood sugar in the way that all the other kinds of, even gluten-free flours will increase. They are high glycemic, increase your blood sugar. So you got to look at the carbs on the package. However, it's best just to eat whole foods. You don't have to worry about that. And again, depending on where you are, if you're already diabetic, if you're in prediabetes, you will have to eliminate or minimize, definitely minimize, the amount of fruit that you eat, and higher glycemic, even whole foods like potatoes and different carbohydrates, vegetables that are high in carbohydrates. So that's number one. And closely behind that, number one, is to eliminate alcohol as well. So really minimizing it if you're just trying to be preventative and proactive. But if you already know that you have a high hemoglobin A1C, that you've already been warned about your blood sugars, then you should eliminate, at least for a few months, alcohol from any alcohol intake, because it does spike your blood sugar. It does act like sugar in the body. Also, caffeine can and does spike the blood sugar, but not in the same way. So like I drink just black coffee when I have coffee. However, I did eliminate coffee when I went through this whole process myself of bringing down my blood sugar. And so just plain black coffee does spike your blood sugar. It's the stress effect, the fact that it affects your cortisol level. It causes your body to release the blood sugar. All right, so that is why we have to reduce or eliminate our caffeine. Now, if it's really hard to give up your caffeine, green tea can be a great alternative. It has been shown to help with lowering blood sugar naturally, and it also gives you a more sustained kind of stimulant than as opposed to the quick spike and drop that you get with coffee. So that's something to think about. All right, and then the next tip that I have for you to reduce your blood sugar is to move your body. Get some sort of exercise in every day, and that can help to naturally stabilize your blood sugar. It doesn't have to be any kind of really vigorous exercise. Sometimes that can actually make it worse, depending on your stress level. But a good walk can do a whole lot of good. And other kinds of more gentle exercise and movement can help you to improve your blood sugar. Now, the next few tips are going to be some supplements that can help you to have more insulin sensitivity in your cells. Now, I do have to have a disclaimer here that you really should talk to your doctor, especially if you're on medication. But in any time whenever your doctor's working with you to lower your blood sugar, talk to him or her about these recommendations. Just see if they have an opinion. A lot of times they don't have an opinion. They say, sure, no problem, because they don't really know that much about them. But you do want to talk to them, absolutely. All right, so number 1 is chromium. Chromium is just a mineral that we need and that we usually get from our food. But as we age, we can get less from our food. We have a harder time absorbing it for a variety of reasons. But it is something that is can be low whenever we are dealing with insulin sensitivity or the lack thereof. So chromium and taking that along with biotin, one of the B vitamins, those can work in conjunction to help. I want to be sure also to mention, whenever you're taking supplements, don't look at it as something like a medication, something that you're just going to be taking for the rest of your life for this condition. The point and the idea is to change your body, change the cells, make them more sensitive to the insulin. The insulin will then not need to be cranked out as high a volume as it did. Definitely with the dietary changes that you do still have to make. You can't just take a supplement instead of a medicine thinking, it's just a natural way of treating this condition. This is actually going to reverse the condition whenever you have that mindset, so that you won't need the supplements long term, just in the phase of reversing the condition and then maintaining it for a while to keep it nice and stable and coming off of those supplements. All right, that's the plan. Another mineral that's really important to prevent or reverse insulin resistance is magnesium. So there is a vicious cycle in play with magnesium and insulin resistance. Insulin resistance can cause magnesium depletion, and then having a low magnesium level can cause insulin resistance. So there's that cycle that's going to be going on unless you do take some magnesium. You take a good magnesium supplement, then you won't have this low magnesium, and that'll stop the cycle of the low magnesium that's causing the insulin resistance, and that can be a big help. So the magnesium recommendations are going to be in the description, some things to think about and look at. And one more supplement that can really be very beneficial in improving your insulin resistance is alpha lipoic acid, ALA. It is an antioxidant that has so many therapeutic benefits, so good for so many things, and including reducing the effect that may have already begun with diabetes or high blood sugar, reducing the downstream effects of damage. That's what antioxidants, really good, potent antioxidants, can do. But also, it will help to protect the beta cells. The beta cells are the cells that produce insulin. And one of the reasons why we go from prediabetes to diabetes is because the beta cells become fewer and smaller. So ALA will help to protect those beta cells so that you can continue to produce the insulin. Now, if you have already been diagnosed, though, with diabetes or prediabetes, if you know you're kind of on the way there, you've been warned, it needs to be a more aggressive approach to really let your cells become more sensitive, more receptive to insulin, allowing it to do its job. And that's how I help my clients. So if you need a more aggressive approach, you need the support and the step-by-step how to do it in a way that it actually is effective. I work with your doctor and you to create the plan and handle that. So reach out to me if you would like to have that help to really reverse your cells' resistance to insulin. If this has been helpful for you, I would love for you to subscribe to my channel. Every Friday I put out a new video to help you to reduce your cravings so you can eat the foods that are really going to nourish you and help you to have a healthier body and weight loss. All right, until next Friday, bye for now.